Hey guys, Jenny PRD. Thanks so much for checking in. My diet and disease prevention series continues with diabetes, and this video I'm going to talk about pre-diabetes as well as risk factors that increase your risk of getting diabetes. So pre-diabetes is a diagnosis that you get when your blood is tested, your blood sugar, and it's not quite high enough to be diagnosed as diabetes, but it's above normal. So people who have pre-diabetes, according to the Academy of Nutrition and Dietetics, or eatright.org, more than 1 in 3 people have pre-diabetes, and 90% don't even know it. So people with pre-diabetes, if they do not make some lifestyle changes, such as exercise, weight loss, and even improving their diet, likely will develop type 2 diabetes. So type 2 diabetes, again, genetics play a role, same with race and ethnicity, unfortunately, play a role, and there's definitely some ethnic groups that are at risk for type 2 diabetes. So if you are African American, Latino, Native American, Asian American, Pacific Islander, or even the aging population, that increases your risk of developing type 2 diabetes. Other things that put you at risk is having gestational diabetes during pregnancy, being overweight or obese. So overweight is a BMI at 25 to 29.9, and obese is a BMI greater than 30. Having low HDL or low good cholesterol, having history of high blood pressure, history of stroke, as well as having a close relative that has type 2 diabetes. That increases your risk as well. If you are diagnosed with polycystic ovarian syndrome, PCOS, that increases your risk because people with PCOS tend to have insulin resistance, and that is the whole problem with diabetes is our cells are becoming more and more resistant to insulin, causing our blood sugars to stay high. And even people with depression, studies are continuously ongoing. What comes first, diabetes or depression? Is it the medications or things like that? So depression even increases your risk of developing type 2 diabetes, as well as how you deal with stress. So lots of things that you can change and some that we can't. But again, just know that with type 2 diabetes, diet and exercise definitely play a huge role. So thanks so much for watching, and stay tuned for more videos.